Orthopedics of the pelvis. Many injuries of the pelvis relate to high velocity trauma, particularly involving the posterior elements. It may also involve the lower lumbar spine. These can be very serious injuries and result in shock and death. The basic principles are to put the fracture or fractured pelvis back into position, and that will arrest the bleeding from the raw bony surfaces. Here's a patient able to single leg stand after anterior and posterior fixation fractured pelvis. He slid under a train, he got out. He rushed out of a train at a train station to have a pee, and as he rushed back to the train, the door closed and he slipped underneath the train wheels. Anterior inferior iliac spine pain, avulsion here. Anterior disruption of the pelvis, see, symphysis pubis disrupted. Look at the posterior elements. External fixator for anterior disruption holds it well. May not be enough of this posterior fracture. Here are pin sites of this patient also had laparotomy. Anterior fractured pelvis, convolution here. You can hold this with the external fixator. Anterior inferior spine injury. Anterior pelvic fracture, need to check the SI joints carefully. This will need open reduction to fixation. You could hold an external fixator, but usually best to put a plate across here. Avulsion and short tuberosity, they'll heal. Avulsion of the anterior inferior iliac spine, non-operative management. Bilateral fracture dislocation, motor vehicle accident, 20-year-old. Anterior, posterior, serious injury. Here's an external fixator being applied and an IM nail, the femur, a 32-year-old from a car accident. And he's able to get around, ambulate with the fractured femur, the nail and the external fixator. Fracture the anterior pelvis. Fixator used to treat a fire door had fallen onto this patient, smashed his anterior pelvis. Fracture dislocation of the hip. So you can put the hip back in, but may be held out. There'll be fracture involving at least the posterior wall and a medial wall, and maybe the anterior wall of this acetabulum, so they'll require open reduction, internal fixation of the acetabular components. Fracture of the ischium. Fracture left hemipelvis. Right pupil blown, 30-year-old. So, fractured pelvis, high velocity, will also involve head injuries, chest, abdominal injuries. Don't forget those. Injections for infertility around the hip, fractured neck of femur. Fracture of the sacrum, hard to evaluate and see. If there's most of them non-operative management. If there's dislocation of the SI joint, you'll need to open that and deal with it. Fracture of the pelvis in a child, 9-year-old. These two were non-operative management, huge healing potential. Fracture of the pelvis, blood at the tip of the urethra. The fracture pelvis usually indicates a rupture of the urethra. Can't put a catheter in, have to do a suprapubic catheter. Fracture of the pelvis, a 37-year-old. This will require open reduction, internal fixation. Open book fracture, that means the anterior, the symphysis, the pubic symphysis is open. So bring it together. Here's a fracture, open reduction, internal fixation of fracture in the pelvis, of the pelvis and of the acetabulum. Here's plates put across symphysis pubis and also reduction of the displaced or dislocated SI joint. Fracture pelvis, anterior and posterior, with vertical displacement posterior. Very unstable. Needs something done across the back, something done across the front. Could well be nerve damage in this particular case. With this one, we put Harrington rods across the back and held them in place to reduce the posterior elements. Pelvic tilt, or you can put through small incisions a reconstructive plate across the back to hold an 18-year-old. Here's a placement of the sacral bar. And here's a patient already demonstrated. And here's a sacral bar. So ilium across there, across the midline and out the ilium on the other side. Little scars, they do well. Sacroiliac inflammation, bone scan can be hot for infection in this area. 6-year-old pain around the sacroiliac area. Bone scan is useful to discern an injury in that region. I hope you find this interesting. Thank you.